Many of you are concerned about postpartum mental health issues declining to such an extent that they turn into postpartum psychosis. So I've decided to dedicate this video to the different signs and symptoms to help you make a sort of distinction between them, between postpartum depression. It's also referred to as PPD. It's also PPA, postpartum anxiety, and PPOCD, postpartum OCD. And I talk a lot about these postpartum mental health struggles in my videos and my blogs. And there's also a mental health condition called postpartum psychosis, and its abbreviation is PPP. So all of the above are very serious mental health conditions that can occur after childbirth. And in this video, I'd like to give you an understanding, sort of an overview, if you will, of the differences between PPD, PPP, as they are sometimes seen as one and the same condition, when they clearly aren't. So I'll start with PPD, postpartum depression. Now, this is a mood disorder that affects some women after childbirth, and it typically develops within the first few weeks to months after delivery. Signs and symptoms of PPD, they include persistent feelings of sadness, feeling empty, feeling hopeless. People lose interest or pleasure in activities. So a lot of overwhelm, fatigue, no energy, loss of energy. There'll be changes in appetite, weight changes, often sleep disturbances, insomnia. It could be insomnia, but it could also be excessive sleeping. Difficulty bonding with your baby is also a sign of postpartum depression. Irritability, very intense irritability, or even anger, a term used often is perinatal rage. That's also part of PPD. Feeling completely worthless, feeling guilt, difficulty focusing, concentrating, finding it really hard to make decisions on things. And also recurrent thoughts of death or suicide, and that's in the more severe cases, but they also can be part of PPD. And the prevalence of PPD varies, but it is estimated that it's around 10 to 20% of women may experience PPD in some form. However, the exact percentages, they can vary depending on the population studied and the diagnostic criteria that was used during that study. So postpartum depression, as I said before, it's often confused with PPP, postpartum psychosis. And the reason for that is that there is some overlap in symptoms and severity in symptoms. So that was the overview of the PPD, postpartum depression, and I'll try and now give you more of an overview of postpartum psychosis, which is a rare but a very severe psychiatric emergency, and it occurs shortly after childbirth, mostly like within days or weeks. I think typically within the first 2 weeks. So that already differs from postpartum depressions, which can be months after postpartum. And PPP really requires, basically the same as postpartum depression, requires immediate medical attention. But again, as the signs and symptoms are far more severe with postpartum psychosis and far more, they show in a much bigger way, mostly. So immediate medical attention will be sought for PPP. Yeah. So signs and symptoms. I was going to tell you about signs and symptoms. I lost my track of thought there. PPP signs and symptoms are, amongst others, hallucinations, like seeing or hearing things that aren't actually there. Delusions, which are false beliefs, maybe believing the baby isn't yours, or believing that the baby's no longer alive, or believing that you're not the mum, or false beliefs. Also very disorganized behavior, very severe mood swings. Mood swings, again, that's an overlap with postpartum depression, but they're very severe. That's also one of the symptoms. Also extreme agitation or restlessness, like really, really not being able to sleep, or maybe not even sleep, but constantly feeling extremely anxious, often up to a point where there's paranoia or a lot of suspiciousness. As I said before, suspicion of people around your baby, maybe that you're not right for the baby, or the baby isn't yours, things like that. There's also often confusion or disorientation involved. Thoughts of harming oneself or the baby. And PPP is considered, as I said before, it's really a medical emergency, and it requires prompt evaluation and treatment. And PPP is not there as often compared to postpartum depression. It's estimated to affect around 0.1 to 0.2% of women. So you see that the chances of your postpartum mental health issues, that they are PPP, postpartum psychosis, or that they will turn into it, are not very high. 0.1 to 0.2% of women it's a lot lower percentage than postpartum anxiety, postpartum depressions, other postpartum mental well-being, mental health disorders. So that's also a huge difference with postpartum depression, that the amount of people that go through it, however horrible it is, that the amount is a lot lower. So it's important to note that postpartum psychosis is really separate and a much more severe condition compared to postpartum depression. While PPD is more common and it's hugely distressing, PPP poses a much higher risk of self-harm, harm to the mother or harm to the baby. So if you're someone, or if you know someone who's experiencing these symptoms of either conditions, then it really is crucial to seek immediate medical help and support from healthcare providers or healthcare professionals who specialize in perinatal mental health, because they can provide with the accurate diagnosis. Self-diagnosis is unfortunately a common thing now that the internet's around and so accessible, but proper diagnosis and proper treatment and a good support system, that's extremely important. So please remember that these percentages mentioned, they are rough estimates, and the actual rates can vary depending on lots of different factors, like population demographics, the way that they did these studies, the methodologies they used, diagnostic criteria used. Even parts of the world can differ from one to the next. And postpartum depression and postpartum psychosis, they can be confused or misunderstood due to several reasons. So as I mentioned before, there are some overlapping symptoms. While PPD and PPP are distinct conditions, they can share common symptoms. The mood changes, the sleep pattern disturbances, difficulty focusing, concentrating. That's an overlap in symptoms. It can make it challenging to differentiate between the two conditions, and especially in the early stages. So generally, there is more awareness and discussion surrounding postpartum depression compared to postpartum psychosis. And, as a result, healthcare professionals, family members, even the individuals themselves, you may not be familiar with PPD. And that can lead to a potential bias or tendency to even attribute all postpartum mental health symptoms, to attribute them to depression. And there's also a lot of stigma around postpartum mental health conditions. And lots and lots of misconceptions, unfortunately. And in turn, these can hinder open discussions and accurate recognition of these specific challenges associated, especially with PPP. The focus on PPD may overshadow the understanding and then the identification of other postpartum mental health conditions. And note that there is a slight overlap, but also a distinction to be made when it comes to the timing. As I said before, the timing of PPD and PPP developing. PPD typically develops within the first few weeks to months after childbirth, whereas PPP emerges a lot quicker, like really within the first 2 weeks, most likely within days. And postpartum psychosis happens relatively rapidly, and it's often more severe in symptoms. So, for example, symptoms such as hallucinations and delusions, they are not uncommon with postpartum psychosis, and they don't really occur with postpartum depression. So this may make it all hopefully a bit more easy to distinguish if you're concerned about these two. Having said that, in some cases, the progression of PPD can become, especially left untreated, can become more severe and then may mimic certain aspects of postpartum psychosis, which again, that makes it confusing. So the advice is always to seek help immediately. And unfortunately, in some countries, the rules and regulations around healthcare are not what you would hope them to be. So there may not be routine screening for postpartum mental health issues, including both PPD, PPP, or PPA, or PPOCD, any of the postpartum health issues. Maybe healthcare in your country is limited. And without the correct and proper assessment and the correct diagnosis, then it becomes really challenging to differentiate between the two conditions and to provide appropriate and timely treatment. So addressing this confusion between PPD and PPP, that's hugely important, to increase your awareness, but also to increase general awareness, to educate healthcare professionals in countries or states where there is not a lot of knowledge on the subject. That's so important. It's immensely important. And to promote accurate screening and assessment protocols, I think that's imperative, not only for the mother, but also, to enhance support for the families, because at the end of the day, you're all involved. Another common question is that I saw a lot is who is susceptible to postpartum psychosis? And while postpartum psychosis is a relatively rare condition, remember it's only 0.1 to 0.2% of women that go through this condition, there are definitely certain factors that may increase the susceptibility of developing it. For example, personal or family history. Women with a personal or family history of a bipolar disorder or schizophrenia or previous episodes of postpartum psychosis, they have an increased risk of developing it. There's also an increased chance for women who have previously experienced postpartum psychosis to go through it again. And I'm not sure about the percentages. I'm not sure if there are even any statistics out there about this. But to know that you've experienced it before, that puts you at a higher risk. So if you haven't, then always seek professional help as soon as you find out that you're pregnant again. I would hope that you would be monitored throughout the entire pregnancy. Or if you know someone in this position, then always encourage them to do so. And women with a diagnosis of bipolar disorder or a history of other severe mental illness, such as schizophrenia, they are also at an increased risk of developing postpartum psychosis. So Also, if you've always been a very bad sleeper, so sleep deprivation or very irregular sleep patterns, they can also be a triggering factor for postpartum psychosis. And as most of us know, the demands of caring for a newborn that can usually contribute to sleep disturbances. And pregnancy in itself, especially the last weeks of pregnancy, they can really mess with your sleep. So it's very, very important to always be on the lookout for signs and symptoms of, postpartum mental health decline, especially when your sleep patterns start to become severely disrupted. If you've experienced a lot of stress throughout your life or throughout the period towards when you became pregnant, then it's important to know that can also be a trigger for PPP. Maybe stressful life events, maybe such a loss of a partner, loss of baby, relationship difficulties, or financial stress, any form of high stress levels. Again, that can increase the risk of developing PPP, or any of these above mixed together. If you're a bad sleeper and there's a lot of stress, and that there have been mental health issues in the past, then be aware of that. Be on the lookout for signs and symptoms and communicate them with your health professionals. And another contributing factor generally for postpartum mental health decline is an inadequate support system. If there's not much support from families, from family members, from friends, from your partner, basically during the pregnancy and the postpartum period. And that can also, again, increase your stress levels and then potentially increase that risk of PPP happening. So many new mums and dads go through stressful moments before, during, and after pregnancy. And none of that is abnormal in itself. Absolutely not. So that's definitely not what I'm trying to say. And the same goes for disrupted sleep patterns. These are common things. Therefore, it's important to note that while these factors may increase your susceptibility to PPP and to PPD, the exact cause of postpartum psychosis, it's not still fully understood. And the reason for that is likely to be a combination of genetics. If you have these things in your genes, passed through you in your genes genetically, and that can contribute also. Hormones, the effect of hormones in our body is a lot known about it, but there's also huge amounts of information that we're still trying to figure out. Also, environmental factors can contribute. If you live in an area where there's a lot of stress going on, that can also contribute to any of this. Especially the genetic factor, that very often comes as a surprise. So where possible, try to gather as much information about this from other family members if you can. Because, sometimes local GPs can help unsurface some relevant information, and try to be as open as possible about it. It may be worth it to ask these questions about this subject if you're unsure. If you're someone, in your family, ask around, any concerns about postpartum mental health. If there are any concerns, then ask around and make sure that you have all the information that you need, because it's really important to seek professional help from a healthcare provider who specialises in perinatal mental health, and they can provide proper assessment and support and treatment options. But they really need to have the whole bigger picture. So if you do seek help, be as open and communicative and verbal about everything that you know about yourself, about your past, etc., because that's the best way of at least coming up with a plan that if anything happens, then you and your baby are in the best and safest and healthiest place. So I hope you now have a clear understanding of what postpartum psychosis, PPP, is, and how fortunately uncommon it is, and what the differences are between PPP and PPD. I hope that helps. Thank you for listening. Take care.